One of the local stories of summer so far has been Helen Kelly's fight to get medical cannabis to help with pain relief for her lung cancer. Morphine is available, but it makes her feel really awful. Cannabis isn't available to her legally, but it works for her without the same side effects as morphine. This is part of a larger discussion about the use of cannabis products in medicine that's taking place in New Zealand and has been for some time. Peter Dunn, the Associate Health Minister, has said the government won't be swayed by emotional arguments, but should ministerial approval or ministry approval be required for the use of cannabis-based medicines that have been fully tested and approved and are already freely used overseas. Carterton girl Grace Yeats was 13 when she was made devastatingly ill in 2013 by severe ganglia necrosis. An approved cannabis spray, Sativex, is becoming available as a medicine elsewhere, but in New Zealand special approval is still required for this. It's made a radical difference to Grace. Grace's mum Tracy told me about life before this spray.
Just to look at her makes yourself feel uncomfortable. Her legs are locked. They can't bend. Her toes look like they've constantly got cramp. She was still having a lot of spasms, especially in the evening time, late afternoon, which would be a lot of back arching, terrified look in her face, arms very stiff, twisting, and that was fairly constant.
And Sativex, how did you hear about this drug, this cannabis-based medicine? How did you hear about it?
Well, the first time cannabis was ever mentioned was actually one of the nurses in Starship when Grace first got sick. I'd never heard of it being used for this sort of thing before and hadn't even considered it, but that kind of planted the seed in the back of my head. And probably about 18 months ago I started getting in contact with people through the internet that have been using it, and the whole Charlotte's Web thing as well. Sativex has actually been made for muscle spasms in people with multiple sclerosis, so I figured we were closer to having the condition that it was made for, and it just kind of snowballed from there. We've exhausted other treatments. You know, I wouldn't want to be in that situation, and anything that I can do to make it better for her, to make her life more livable, because she's not dying. We don't know what her life expectancy is. She's still very much here with us and just has to suffer through every day.
Can I just clarify, because there's some confusion around this, did you have to get ministerial approval to get Sativex for Grace?
Yes, we did. Yep, that was all done through the specialists up in Auckland.
Okay, so the form I have that says you have to submit an application for ministerial approval to prescribe Sativex, what that was a procedure you went through using your specialist?
Yes, that's right.
Okay, what difference has Sativex made?
And that was approved. Even after the first spray, she said, I feel happy, I feel good. And I don't mean that she's stoned, because I don't believe she feels that way at all. It's the relaxing of her muscles. She has gained more movement in her hands and her arms. She will never have that movement back in her legs. I mean, they're just contracted and pretty much stuffed. So to get movement back in our arms and our hands is huge, because that means that she can navigate her iPad with her talking app on it. So she is much more fluent in working around her touch chat app. She's doing different things with her hands. She's helping us get herself dressed and undressed.
Wow.
You know, she's bringing her other hand up and taking the sleeves out of clothing. Which doesn't sound much when you think back to what I had, but yeah, it's pretty significant now. She's throwing balls. She's trying really hard to catch balls. She's passing things hand to hand, pointing. The other day she asked for eggs on toast, with toast, and she ate the whole thing. So she's done that 4 days in a row now.
Wow.
Which was her favourite food before. She'd linger over her morning eggs quite happily.
Okay,
yeah.
so your sense...
those sorts of things too. I mean, that's going to give her such a boost.
Tracy, how much does Sativex cost? How much does it cost you?
For our pharmacy to provide it to us, it's costing $1,100 for the month's supply.
And how are you able to pay for that? Because that's a lot of money and you haven't got that. How are you paying for it?
Well, it's been pretty amazing. The first couple of prescriptions that we have collected have been paid for by the money left over from the initial fundraising that was done for Grace by the Grace Yeats Trust. And then a charity called $1 Warriors has taken us on, and the other day they ran a page on Give a Little, and they have managed to already raise enough for 2 years worth of Sativex for Grace, which I'm truly grateful. I can't speak highly enough of $1 Warriors, because I had no idea where I was going to get that money from. If we tried Sativex and it hadn't worked, then that would have been, fine, done, dusted. But it did leave me in a very awkward place as to how I was going to carry on with that amount of money.